Eastern wisdom teaches us that longevity is not just about living many years, but how we live each one. Dr. Shigeaki Hinohara, the renowned Japanese doctor who lived up to 105 years, has revolutionized our understanding of healthy aging with a fundamental principle. Human vitality depends on the maintenance of all natural aspects of life, including physical intimacy. What many ignore, and the great scholars of longevity like Dr. Hinohara emphasize, is that abandoning sexuality with advancing age is not just a loss of pleasure. It is a renunciation of one of the most powerful natural medicines at our disposal. When we look at the most longevity cultures on the planet, such as Okinawa in Japan, a surprising pattern emerges. Maintaining physical intimacy throughout life is a common denominator among those who not only live anymore, but live better. Modern medicine finally confirms what Dr. Hinohara has defended for decades. Regular sexual activity in old age is not a luxury or a frivolity. It is an essential component for physical and mental health, with measurable impacts on virtually all human body systems. The silence on this theme has cost our society expensive. While doctors prescribe pills for blood pressure, diabetes, and arthritis, they rarely discuss how physical intimacy deprivation may be exacerbating these same conditions. Dr. Hinohara, known for her unconventional approach to medicine, often surprised her elderly patients by asking her intimate life, not out of curiosity, but because she understood the profound biological connections between sexual expression and the global health of the aged body. The scientific data we gather are alarming. Prolonged sexual abstinence in old age is associated with faster cognitive decline, reduced immunity, worsens in cardiovascular conditions, and significant decrease in quality of life. Even more surprising are findings on how interruption of sex life accelerates the process of cell aging, affecting from tissue regeneration to hormonal production. What happens to your body when you completely interrupt physical intimacy can be compared to turning off an important biological maintenance system. When Dr. Shigeaki Hinohara revolutionized geriatric medicine in Japan, he often surprised his colleagues by emphasizing that the human body was not designed to turn off natural functions with age. One of the main systems that suffers when neglected is precisely the sexual, which does not exist in isolation, but as an integrated part of our complete physiology. Research conducted at St. Luke's International Hospital, where Dr. Hinohara worked for over 70 years, revealed that elderly people who maintain regular sexual activity have significantly higher levels of oxytocin, dopamine, and endorphins, the hormonal cocktail of youth that regulates from blood pressure to immune response. The abandonment of physical intimacy in seniors triggers a waterfall of physiological reactions rarely discussed in medical offices. First, there is a drastic reduction in blood circulation in the pelvic regions, leading to progressive tissue atrophy. In women, this accelerates vaginal dryness and increases the risk of recurring urinary infections. In men, the prolonged absence of erections, even during sleep, compromises the oxygenation of penile tissues, contributing to erectile difficulties that become gradually irreversible. Dr. Hinohara observed in his longitudinal studies that sexual health and cardiovascular health are closely connected, sharing the same well-being markers. Even more alarming is the impact of this forced abstinence on the immune system. Dr. Hinohara, known for her integrative approach to medicine, documented how to reduce sex hormones after long periods without intimacy progressively weakens the immune response. His studies with Japanese centenaries in Okinawa consistently demonstrated that those who maintained some form of sexual expression to advanced ages had higher counts of natural killer cells, essential components in the prevention of viral tumors and infections. The complete interruption of sex life effectively accelerates the process of immunosenescence, making the body more vulnerable to diseases that could naturally be combated. Modern medicine finally reached what Dr. Hinohara proposed decades ago: body's understanding as an integrated system where no function exists in isolation. The decline in hormonal production caused by prolonged sexual abstinence not only affects libido, impacts bone density, increasing the risk of fractures, compromises sleep quality, essential for cell regeneration, and even decreases cognitive capacity by reducing brain neuroplasticity. In his lectures for the elderly, Dr. Hinohara often cited studies demonstrating how sexually active men and women after the years, were performing better performance in memory tests and executive functions, a correlation that he attributed to better brain oxygenation and hormonal equilibrium. Finally, sexual abstinence directly impacts the body's energy metabolism. Dr. Hinohara noted that elderly patients who had regular intimacy showed better glycemic regulation, less insulin resistance, and more efficient basal metabolism, factors that partially explain why these people tended to maintain healthy weight more easily. The cycle of sexual excitement, even without culminating in complete relationships, stimulates the production of DHEA, dehydropoprosterone, a precursor hormone often called the source of youth, whose production normally dramatically declines after 50 years. The maintenance of these hormone levels through regular sexual activity was one of the secrets that Dr. Hinohara consistently observed among his centenary patients who had extraordinary vitality. Dr. Hinohara's holistic approach to health has always emphasized that the mind and body are inseparable, a principle that becomes even more evident when we analyze the psychological effects of sexual abstinence on old age. In his extensive interviews with Japanese centenaries, he repeatedly documented how abandonment of physical intimacy was not just a symptom, but often the cause of geriatric depression. The loss of this fundamental channel of emotional expression, human connection, and personal validation creates a psychological vacuum that can rarely be filled by other activities. Dr. Hinohara noted that, contrary to common stereotypes, elderly keep their need for touch, physical affection, and the feeling of being desired, and the frustration of these basic needs often manifests as irritability, apathy, and a deep sense of identity loss. The perhaps more neglected aspect, but Dr. Hinohara emphasized in his lectures, is how sexual intimacy works as a powerful natural anxiolytic. His research team at St. Luke's Hospital documented how sexually active elderly showed significantly lower levels of cortisol, stress hormone, even when facing important challenges such as health problems or mourning. Sexual activity stimulates oxytocin production, often called love hormone, which not only strengthens emotional bonds, but has shown direct effects on reducing anxiety and regulating the autonomous nervous system. The prolonged absence of these biochemical benefits creates a chronic state of tension that directly contributes to sleep disorders, hypertension, and even to the progression of neurodegenerative diseases. Sexuality in senior age is also directly connected to self, perception, and self-esteem, themes that Dr. Hinohara addressed a singular candor in a traditionally reserved culture on such subjects. Their clinical diaries report as patients who completely abandoned sex life often began to be primarily seen as old or sick, while those who maintained some form of sexual expression preserved a more positive and dynamic self-image. This psychological phenomenon has physically measurable consequences. Patients with better self-perception showed greater adherence to treatments, greater disposition for physical activity, and better immune response. The way we see ourselves, wrote Dr. Hinohara in one of his latest articles, literally shapes the biochemistry of our aging. In the context of lasting relationships, Dr. Hinohara observed a paradoxical effect. The longer the partnership, the greater the negative impact of the abandonment of physical intimacy. Couples who have spent decades together and stopped playing closely often report a strange feeling of close distancing. They are physically close but emotionally disconnected. This loss of emotional attunement not only affects the quality of the relationship, but compromises one of the most important protective factors against elderly diseases: the feeling of deep social connection. Longitudinal studies coordinated by Dr. Hinohara showed that couples who maintained some form of physical intimacy, even when modified to accommodate physical limitations, had remarkably lower incidence of dementia and better recovery after serious medical events. Finally, there is the element rarely discussed of pleasure as a fundamental right in every phase of life, a principle that Dr. Hinohara defended passionately. In one of his latest interviews at 103, he said that denying the pleasure of the elderly is a veiled form of dehumanization. The ability to feel sexual pleasure does not disappear with age. It only becomes. Voluntary or imposed deprivation of this profoundly human experience often results in what geriatric psychiatrists call progressive anhedonia, the gradual loss of the ability to feel pleasure in any activity. This state contributes to social isolation, a decrease in psychological resilience, and progressive loss of motivation for self-care, exactly the opposite of what Dr. Hinohara observed in exceptionally healthy centenaries, who maintained a hedonistic and affirmative attitude towards life's pleasures, including sexuality. Among the fundamental principles that guided Dr. Hinohara's extraordinary career was his insistence that medicine should treat people, not diseases, and people are full beings with physical, emotional, and spiritual needs that persist throughout life. This holistic approach led him to question established medical dogmas about aging, particularly the implicit notion that certain human functions should naturally cease to advance age. The body does not recognize retirement, he used to tell his patients, emphasizing that biological systems kept in regular use continue to function far beyond conventional expectations. This observation applied especially to sexuality, which Dr. Hinohara classified not as luxury or frivolity, but as a vital function integrated with global health, as important as food, sleep, or physical activity. The longitudinal studies that Dr. Hinohara led to Okinawa, a region known to have the largest concentration of healthy centenaries in the world, revealed a surprising pattern. Maintenance of some form of sexual expression was a common denominator among those who not only lived anymore, but remained functionally independent until much advanced ages. The explanation proposed by the Japanese doctor went beyond the simple correlation. He argued that sexual intimacy functioned as a biological calibrator, a feedback system that kept active multiple neurological, endocrine, and cardiovascular circuits that would otherwise decline premature. More significantly, Dr. Hinohara documented how sexually active elderly people had telomeres, protective structures at chromosomes, significantly longer, a biological marker directly associated with cellular longevity. Dr. Hinohara's integrative view has found initial resistance in the traditional medical community, but has gained scientific validation in the last decades of his life when research in neuroimmunology began to confirm his clinical observations. Particularly remarkable was the discovery that regular sexual activity in old age is associated with higher adult stem cell production and the best tissue regeneration capacity, an effect that Dr. Hinohara had intuited decades earlier by noticing that her sexually active patients recovered faster from surgical procedures. This improved regenerative capacity, he argued, was not coincidence, but a direct result of the hormonal cocktail complex released during sexual intimacy, which included growth factors and natural anti-inflammatory compounds impossible to completely replicate by pharmaceutical interventions. Perhaps Dr. Hinohara's most unique contribution to our understanding of geriatric sexuality was his insistence that benefits transcended the merely physical or psychological to enter the dimension he considered equally important, the spiritual. In his lectures at St. Luke's University, he often argued how sexual intimacy in advanced age functioned as a powerful anchor in the present, an experience that, by its immersive and intensely sensory nature, fought the tendency of many elderly people to live excessively in the past or anxious anticipation of the future. This ability to fully inhabit the present, which Dr. Hinohara considered essential to well-being, was remarkably more developed among the elderly who had some form of regular sexual expression. Physical intimacy, he wrote. He recalls us that we are still incarnate beings, capable of feeling fully, a conscience that in itself has rejuvenating effect. The practical implications of Dr. Hinohara's studies on sexuality and longevity were revolutionary when proposed and remain relevant today. He was one of the first doctors to formally recommend that hospitals and institutions for the elderly recognize the right to privacy for couples, a position that caused controversy at the 1970s Japanese health system. More significantly, he introduced into the Japanese medical formation that the cessation of sexual function in old age should be seen not as natural development, but as a possibly treatable medical condition. This paradigm shift inspired a whole generation of geriatricians to proactively address sexual issues with elderly patients, resulting in interventions that often improved sexual function, but multiple global health markers. A healthy sex life in old age, concluded Dr. Hinohara, is no guarantee of longevity, but its complete absence is almost always a sign that multiple systems are in accelerated decline. Dr. Shigeki Hinohara was notoriously pragmatic in his health approach, a trait that extended to his discussions about sexuality in the elderly. He fully recognized that there are real challenges, both physical and psychological, who may interfere with sexual expression between the elderly, but categorically rejected the notion that such obstacles should be passively accepted. Adaptability, he used to tell his older patients, it's the secret of continued youth. In his consultations, he demystified age-related physical changes, such as decreasing vaginal lubrication in women, or the slower erectile response time in men, presenting them not as failures, but as transformations that invite new forms of intimacy. This recontextualization had a profoundly therapeutic effect, allowing patients to abandon expectations based on youth standards and discover new possibilities adapted to their current reality. Particularly innovative was Dr. Hinohara's approach to patients with chronic medical conditions that often interfere with sexual function, such as diabetes, hypertension, or arthritis. Instead of accepting sexual dysfunction as an inevitable side effect, he worked in collaboration with his patients to adjust medications, explore alternative timely times when symptoms were less present, and adapt positions and practices to accommodate specific physical limitations. This personalized approach often produced surprising results. Patients who had completely abandoned sex life found that with appropriate adjustments, they could resume physical intimacy in satisfactory forms. Dr. Hinohara meticulously documented these cases, demonstrating that even serious medical conditions rarely justified the complete cessation of sexual activity. Dr. Hinohara was equally straightforward when addressing psychological obstacles, particularly negative body image and internalization of social stereotypes on aging and sexuality. In support groups that he specifically established for the elderly at St. Luke's Hospital, he used techniques derived from cognitive behavioral therapy to help patients identify and challenge limiting beliefs. The mind often gives up on the body long before the body really had to give up, he observed, noticing how patients who surpassed psychological blocks often rediscover physical capabilities they believed to have lost permanently. A particularly effective technique that developed was the diary of sensations, where patients were encouraged to document pleasurable sensory experiences, gradually reconnecting with their ability to feel physical pleasure in increasingly intimate contexts. For elderly couples facing challenges in sex life after decades together, Dr. Hinohara offered a comforting yet challenging perspective. Familiarity can fall asleep passion, but also offers unmatched security for exploration and reinvention. He systematically recommended that older couples treat their sexuality as a new territory to be explored together, with curiosity, open communication, and willingness to experiment. This approach not only revitalized intimate connections, but often strengthened the relationship as a whole, creating new levels of complicity and mutual understanding. In his clinical records, Dr. Hinohara documented how couples who followed this guidance often reported sexual satisfaction equal to or greater than they had experienced in earlier phases of life, a phenomenon that he attributed to greater emotional maturity and freedom of performance pressures that often limit sexual expression in youth. For elderly without fixed partners, either by widowhood, divorce, or personal choice, Dr. Hinohara was equally emphatic about the importance of maintaining some form of sexual expression. Contrary to social taboos, he openly defended masturbation as a healthy and beneficial practice for lonely elderly, citing its benefits to maintaining sexual function, stress relief, and hormonal regulation. For those open to new relationships, he offered practical guidance on how to navigate the scenario of senior meetings with realism and self-confidence. "The body changes with age," he said, "but our need for human connection remains constant." This validation of sexuality as a legitimate need in every phase of life allowed many elderly patients to overcome shame and self-judgment that often accompany sexual interest in advanced ages, a crucial first step for healthy relationships. Dr. Shigeki Hinohara's most lasting contribution to geriatric medicine was his insistence on the complete integration of all aspects of human life into a coherent plan of health, and sexuality occupied a central position in this vision. treating blood pressure while we ignore the patient's intimate life, he often watched in his lectures to resident doctors. It's like meticulously regular car fuel while we ignore the engine without lubrication. This simple mechanical analogy captured its conviction that sexual expression was not a luxury or expendable function, but an essential component of an integrated health system, particularly at advanced age when multiple biological systems need regular stimulation to maintain functionality. In his clinical practice, Dr. Hinohara was a pioneer by including questions about sex life in routine geriatric evaluations, raising this aspect to the same level of importance as nutrition, sleep, and physical activity. Dr. Hinohara's integrative approach was particularly evident in his view of the relationship between physical exercise and sexual function in old age. He developed specific exercise protocols focused on strengthening pelvic muscles, increasing flexibility, and improving cardiovascular resistance in directly beneficial ways for sexual function. Prepare the body for pleasure, advised his patients, and pleasure will naturally follow. This pragmatic and direct perspective demystified sexuality while offering concrete tools for its maintenance. Notably, patients who adopted these exercise protocols often reported benefits that transcended the sexual sphere: improvement in urinary continence, reduced lumbar pain, and increased overall energy, demonstrating in practice the principle of systemic interconnection that was central to Dr. Hinohara's medical philosophy. Nutrition also received specific attention in Dr. Hinohara's integrated approach to geriatric sexual health. His studies of Okinawa centenaries have revealed eating patterns consistently associated with the maintenance of sexual function at advanced ages, diets rich in antioxidants, essential fatty acids, and nitrate compounds that support vascular health. More significantly, he documented how traditional Japanese fermented foods contributed to the health of the intestinal microbiota, which in turn positively influenced the hormonal balance needed for sexual function. Its gut and libido are in constant communication, he explained to surprised patients, long before Western science fully recognizes the intestine-red-gond axis. This integrated nutritional view reflected its understanding that healthy sexuality emerges naturally from a properly nourished and biochemistically balanced body. Dr. Hinohara was equally revolutionary in his understanding of the connection between mental health and sexual function in old age. Long before Western medicine fully recognizes the impact of depression and anxiety on geriatric sexual function, it was implementing mental health interventions specifically focused on restoring healthy sexual expression among the elderly. Mindfulness techniques adapted from the Zen tradition, conscious breathing exercises, and gratitude practices were integrated into the treatment of patients with sexual dysfunction, often with remarkable results. The anxious mind is the greatest enemy of sensual pleasure, he observed, teaching mental presence techniques that helped elderly to rediscover body sensations that had become dull not by age itself, but by chronic stress and inattention. These contemplative approaches complemented conventional medical interventions, creating a truly integrated model of care. The most visionary aspect of Dr. Hinohara's approach, however, was his insistence that sexuality in seniors should not be seen simply as a function to be maintained, but as the way for continuous growth and personal development. The last chapters of our sex life can be the deepest, he used to tell initially skeptical patients, explaining how the freedom of reproductive pressures and the performance anxieties typical of youth created a unique opportunity for fuller exploitation of intimacy. This perspective radically transformed the narrative on aging and sexuality, from inevitable decline to potential evolution. Patients inspired by this view often reported not only maintenance, but true positive transformation in their intimate life after the 70 or 80 years, confirming Dr. Hinohara's intuition that, as in many aspects of human experience, maturity offers qualitatively distinct and potentially richer possibilities than the previous phases of life.